And the top picks this week are a pair of studies in the New England Journal studying a new agent for pulmonary arterial hypertension. This is an agent called riociguat, which is a class of agents that is a soluble guanylate cyclase stimulator. Now, this involves the nitric oxide pathway, which is involved in pulmonary hypertension, where impaired nitric oxide release is part of the pathogenesis. This agent increases cyclic GMP and thereby increases nitric oxide and has both vasodilatory and antiproliferative effects in the pulmonary vasculature. Now, published this week are two studies, one in group 1 pulmonary hypertension, which is sort of the standard pulmonary hypertension, but a second one in group 4, which is due to chronic thromboembolic pulmonary hypertension. And so the first study, the PATENT-1 study, had 443 patients randomized to two different dosing strategies, but the higher dosing strategy against placebo, either on the background therapy that patients were receiving, or some patients were new to therapies, and so not on other background therapies. What was seen was a significant improvement in essentially all the parameters. The 6-minute walk test increased by 36 meters, highly significant difference, but also differences seen in pulmonary vascular resistance as measured, NT-proBNP, and the functional class. And so this was seen in patients not on prior therapy or those on other therapies, and so a nice consistent finding of this agent. In the second study, the CHEST-1 study, there were 261 patients, and again the same improvements were seen, this time a 46-meter increase in the 6-minute walk test, but similar improvements in pulmonary vascular resistance and NT-proBNP. And this is something where there's one of the new indications for this chronic thromboembolism indication. And so an exciting new class of drugs will be reviewed by FDA, but something that we all need to pay attention to be added to the armamentarium for pulmonary hypertension. So for Cardiosaurus News, I'm Chris Cannon.